everyone. My name is Francine Mikla, 21 years old from Mabalacat City. I am still a student taking a Bachelor of Secondary Education major in English at Angeles University Foundation. And it's really my hobbies to do public speaking. I also do hosting and as well as singing in weddings because I also love music. I found out CSA during my reign as one of the candidates of Mutya ng Pilipinas Pampanga 2022 because CSA is one of the sponsors of the said pageant, and as well as to Tita Weng because our reigning Mutya ng Kapampangan first runner-up Liana Laughlin is my friend, and I trained her as I am her Q&A trainer during Mutya ng Kapampangan. One of my concerns is I would like to enhance my beauty, specifically my nose, because I believe that if you really want to boost your self-esteem and your confidence, you also want to improve something, not for the worst, but of course for the better. Please don't forget to click the subscribe button and the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Miss Francine Miklat. Hi there. So actually, Francine is so young, okay? And looking at her face, of course, it's not an anti-aging treatment, okay? And this is more of a beautification and enhancement of a certain part of the face. So right now, we'll be working on her mid-face area, specifically the nose. And Francine, I think, actually Francine has beautiful nose, but it seems like still the concern of Francine. Is that right, Francine? Yeah. Okay, because, well, the nose has some ideal measurements or angles or proportions or dimensions, okay? So if we look at the center, actually, the center, we call it the mid-face area. It's from the mid-brow section to the lowest section of the nose region. Okay, so this one encompasses the mid-face area. Okay, upper third, middle third, lower third. Okay, and if we look at the center, the nose in the mid-face section, we check on the angles here, on the frontonasal angle. We check also on the nasolabial angles, okay? And we do also like a vertical measurement. Like for example, the width of the alars, it should be within that so-called intercanthal width, okay? So like a review for us, the injectors, what we do measurement is like for example, we have the nasofrontal angle here, okay? So ideally like around 130 degrees, 135 degrees, 140 degrees. Anong gusto mo doon, Francine? Saan ka kaya doon? Okay, so if you do like a check of her nasofrontal, it's kind of not within that 130-ish degrees na angle, right? So kind of if you look at the side view, it's still lower. Do you feel like it's still lower, this part here? And if we look at the nasolabial angle here, we want it for women, ideally around 105 degrees, this one here. So it's kind of a bit upturned, but this one is elevated here. And to make it look natural, we wanted the so-called slope, okay? So some individuals still have the so-called supratip break here, okay? There you go. And then when you do your measurement of the width of the nose, it should be within this intercanthal width. Naku po, medyo lumalagpas yata, Francine, okay? Within that. And Asian nose, we have this round tip here. We have wide alars. We have this short columella, okay? Unlike the Caucasians, they have this elevated tip, okay? And then high bridge of the nose. So somehow we want your nose, Francine, to be within the right measurement. It's not making it exaggerated, okay? So we want it balanced, proportion to the shape of your face, correct? So that's with the assessment part. So when we do that checking or evaluation, we do follow those measurements, okay? In terms of the anatomy, Francine, So we're already in the initial evaluation aspect here. Okay, what we watch out will be blood vessels, especially when we're doing injections. Okay, so blood vessels are located in the so-called middle layer of the anatomical tissues, tissue layers, tissue planes. So we want to avoid that middle layer of those anatomical tissue planes. Okay, and the arteries that we want to avoid, for example, when we have our facial artery from the side of the nose. So for example, from here, we have the so-called terminal branch we call the angular artery. Okay, so facial artery terminating to the so-called facial artery. And this one will branch out to the so-called lateral nasal artery. So these are arteries, Ma'am Francine, okay, that we want to avoid. And some people will have this so-called dorsal nasal artery here, dorsal nasal artery here. Or the others will have that branch from the supratrochlear. So you have your supraorbital here, and supratrochlear here, and also here, supraorbital, supratrochlear. And some would have this branch of the dorsal nasal artery. So we want to avoid those branches, okay, when we're doing our injections, especially the filler injections, okay? And filler injections have been reported to cause complications like necrosis. The worst one will be blindness or stroke, okay? So we don't want that to happen because these are procedures that are actually safe when they're done with, or they're done by professionals, okay, by the doctors who are trained to do this. We know anatomy. Even in surgical procedures, you know, surgeons are doing cutting, but they know the anatomy, right? They know what to avoid if we do some cuttings on the face. And same thing when we do injections on the face. That's why we are in med school. These are the things that we are studying for a very long time. And another one is the so-called intercanthal vein, that mostly when we inject into this area here, we have the intercanthal vein. Sometimes this one is the main vessel that will cause the bruising, okay? So those are like blood vessels that we want to avoid whenever we're doing injections on the nose area, okay? So these are procedures that we've been doing for a very long period of time. Even with rhinoplasty, surgeons know those important structures that they have to avoid, right? As well as in non-surgical. That's why we keep on reminding that this should only be done by the trained medical injectors. Okay, so caution again, don't go to untrained, not trained, not authorized, not legalized to perform this kind of nose injections, because there are already reports of blindness and other worse complications from this procedure. Okay, so there you go, Francine. We've learned something which will show the actual procedure when CSA Medical Aesthetics returns. And we're back. So we're now doing the non-surgical nose thread lifting with the use of our PDO threads for Miss Francine. I'll be doing a so-called combination with the hyaluronic filler together with the PDO threads. Okay, I'll pinch the tip and make a tiny injection of our lidocaine here. And after numbing the infratip area, we'll make a puncture for the entry point of our products. And I'll be using my hyaluronic material in this gauge 22 cannula. So this is a high G prime, high molecular weight type of a hyaluronic substance. So this one has this good projection for the nose. The goal is to do nose projection. So I'm just pushing slowly, gently into the tissue space, supraperiosteal, supraperichondrial. It's ideal to inject it on top of the bone and the cartilage, avoiding the fibromuscular layer where you have those vasculatures, the ones we are avoiding. Okay, so the safe anatomical plane will be above the bone and above the cartilage. Okay, so I'll be at the radix part already, pushing a minimal amount of my hyaluronic substance. It's ideal to just use less hyaluronic substance here. We don't want overfilling the radix part. We just want the right amount. Okay, so I'm already in the renion, and then after that we'll go to the tip columella space, and I want to reach the so-called anterior nasal spine, anterior nasal spine. So, siyang pressure, Francine. Okay. And then after this, we'll proceed with our PDO threads. I'm using a 50mm length cannula, 19 gauge 19. And I'll just direct it again in that same anatomical layer, same tissue plane. And then pull out. You leave the PDO strands inside. Okay. Elevating the nose tissues. Okay, and pull out. So we want a result for Francine that's gonna balance the shape of her face because she has a minimal, or rather she has small face actually. So a bit of a discomfort on the radix part. And then after this, we'll be doing the tip columella. And tip columella area. There you go. We'll be using short threads for the columella space. So we have the intercrural space here. We'll just glide one piece there and a second piece there. We're almost done, Francine. There you go. And we'll show the result to Francine when CSA Medical Aesthetics returns. And we're back, so we're now showing the result to Francine. Francine, here's the mirror. Okay. So it's an instant result. Wow. So from that short nose to a long nose, from a wider nose to a narrower and slimmer nose. And it looks like she has this nose line effect from makeup, the nose contour from makeup, right? So with the right dimension, the angles, the height, and the width. Okay. So, comment, Miss Francine.
I didn't expect that the result will be as fast as this, because usually for other treatments, like you will see the results after a few days.
Yeah.
But this one, it didn't even last for an hour for the procedure, but the effect is really as fast as it is.
Yes. Instant result, okay? And natural and beautiful to more beautiful Francine, right? Okay. So we also want to remind everybody that materials we use for treatments like this, of course, they have to go through like testings, clinical trials, and they have to be registered with our FDA. Okay, so these are materials, products that went through clinical testings. Because if you check online, you may see some threads, you may see some hyaluronic fillers. Be careful because there are fake materials or imitations, or we don't know where they got them. Okay, so just be careful po, because I've been hearing some people are checking online and they were saying, oh, the cost of the thread is just like this. Be careful because you don't know where they're from, which company, who manufactured them, and do they have FDA registration. Because we found out that there are products in the market, like for example Botox, Juvederm, Restylane. They are fakes, the ones on the internet, online, those who are doing online selling po. So just a caution to everybody po. Okay, so Francine, thank you.
Thank you, Doc.
So far so good. It was tolerable, right?
I didn't feel anything actually.
Yeah. Actually, we injected the lidocaine. Okay, so we had this lidocaine injection in the entry point. And then I used a hyaluronic dermal filler that also has a lidocaine. That was making the procedure tolerable, so giving you that comfort. Yeah. So it's Francine. Wow. Okay. There you go. So Francine, if some of our televiewers have any question, can they reach you through your social media? Like for example, about this treatment, masakit ba? Kamusta po?
Yes.
Yeah, how was the experience? So can they reach you?
You can reach me through my Facebook account, Francine Miklat, and as well as in my Instagram, francine.miklat. If you really want to have that nose as mine, just message me and I won't hesitate to answer your question.
Thank you, Francine. So if you also have any questions at us, at our clinic. You may email us at csaskinclinic@yahoo.com. We have our Facebook, CSA Medical Aesthetics, our Instagram, CSA Medical Aesthetics. And our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. Okay, thank you so much. And please watch our other videos at our YouTube channel, Contessa Salvador. And thank you for our subscribers for keeping watch or for always watching our episodes. Hope you are learning a lot in every episode. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.